finding a new health plan can be challenging. Deductibles, copay, co-insurance, open enrollment, what does it all mean? We have tips to make it easier on this episode of the Texas Insurance Podcast. Hi everyone, I'm Ben Gonzalez. Today we're going to be joined by TDI's Misty Hinote, and we're going to give you our top tips for shopping for a new health plan. If you find this information useful, be sure to rate and review the Texas Insurance Podcast, subscribe, and share it with your friends and family. Hi, Missy. Thanks so much for doing this today.
Thanks for having me.
You bet. So where can we get a health insurance plan if we're starting to shop right now?
Right. So there are 4 major ways that you can usually shop for a health plan. One of them is through your employer, your job. Ask your boss, ask HR if they offer a health plan. And a lot of times your company will help you pay for it. Another option is your spouse's health plan. If him or her have a plan through their job, you might be able to get on that. But if that is an option, look at your plan versus your spouse's plan to see which one has the better benefits, the better price. We'll get into some more of that later. And then another option is you can stay on your parents' plan until you're 26. You don't have to be enrolled in school, you don't have to live at home, and you don't have to be a dependent to stay on their plan. And then the last option is to shop for a health plan yourself through an insurance company or healthcare.gov.
That's the federal website that has all the health plans listed there.
Exactly.
So if I'm facing a bunch of different plans or my employer offers more than one option, how do I choose the plan that's right for me?
Right. So first you want to start looking at the benefits, and that's the healthcare services and treatments that every plan covers. You want to make sure the benefits that you need are going to be covered. So if you have medical issues, mental health issues, you want to be sure that the plan's going to cover those. And you can ask the plan, whoever's selling it. And then you also want to look at the cost of the plan. You want to look at the premium versus the copays versus the deductibles and see where those kind of align. And you also want to look at the doctors and the specialists. So a lot of plans make you use a network, or want you to use a network to get a cheaper price. And that's just a group of doctors and specialists and facilities, emergency rooms that they want you to go to. So if you really like your doctor, really like a specialist you've been using for years, you want to make sure that they're going to be in that network. And the same goes for prescriptions. If there's drugs you take, you want to make sure that the plan's going to pay for those drugs. And even if you look last year, formularies at the list of medications and networks can change every year. So you want to make sure that your doctors are going to be in your network.
Okay, so we make sure that our doctors are in those networks, the plans that we're considering, and make sure you ask about the co-insurance and the co-pays, the out-of-dollar costs. Any other tips for shoppers?
Yeah, you want to shop around. So if you went to healthcare.gov last year, there might be more plans that are covered in your area this year. So check those out. You might not have seen them last year. There could be fewer plans, but there could also be more plans. And then you really want to be sure that your doctors and specialists and prescriptions are going to be covered, that you're going to be able to go to those doctors that you want to in the plan. And plans can change that list of doctors every year and that list of prescriptions. You just want to check those every year.
So even if you're on the same plan, it's good to check and make sure your drugs and your conditions are still covered.
Right. Because once you're in a plan for a year, you're in it for a year. So you want to be sure you like your plan.
Okay. So when shopping for plans right now, that means there's potential targets out there for fraud. Anything that consumers need to look out for? Any red flags to watch out for?
Right, for sure. You don't want to be pressured into buying a plan. If an agent says there's a one-time deal or there's a sale going on, there are no sales in health insurance. So take your time that you need to make your selections. And be wary if someone calls you out of the blue offering you a health plan. And especially don't give those people any of your personal information, banking information, Social Security number, Medicare number. And then if a plan sounds too good to be true, it probably is. If it has a really low price, you want to look at those copays, the deductible, the co-insurance to see why that plan is low. And it probably doesn't have as many benefits as another plan.
That's exactly what I was thinking. It might be a very narrow plan, and that's why it's a lot cheaper.
Right.
This time of year, people are probably going to hear about open enrollment. What does that really mean?
Right. It's the time of year that you can shop for health plans. So you can get a new health plan, you can drop a plan, add a plan, and that goes until January 15th. And that coverage will start February 1st.
But if you wanted to start January 1st, you have to do it in December.
Yeah, December 15th is the deadline if you want it to start January 1st, right?
Are there other times of the year when you can hop on those healthcare.gov plans?
Yep. There's something else called a special enrollment period. And that's if you have a qualifying event, like you got married, you lost your job, you had a baby, adopted a baby, or your income fell below a certain level, then you can get on a healthcare.gov plan. You usually have about 60 days before or after the event to get on one of those plans.
Right. Those life events that change, maybe you can change into another health plan. If people still have questions about shopping for health insurance, where should they go?
Yeah, our website has some great information. We have a health shopping checklist, some things to go through in your brain or go through with the plan that you're looking at to be sure you're getting all the benefits that you need. Then you can call us too. Our helpline has some great people waiting to answer your calls.
Perfect. Thank you so much for doing this, Misty.
Thank you.
So now that you know how to find a health plan, watch this video to learn how to prevent health insurance fraud. If you've got insurance questions, call our helpline or visit the TDI website. That's it for today. We'll talk to you next time.